HIPAA Compliance Guidelines. HIPAA, the Health Insurance Portability and Accountability Act, is a crucial legislation regulating the use and disclosure of protected health information. Protected health information. Protected health information is private and sensitive information about a person's health and medical history. This includes name, address, medical conditions, treatment details, and even your medical bills. Healthcare providers and organizations have strict rules they must follow to make sure this information is secure and used appropriately. HIPAA Compliance Health Insurance Portability and Accountability Act. HIPAA is a federal law adopted in 1996 to protect patient privacy and healthcare data security. Its key goals are to protect the confidentiality and integrity of PHI while also protecting individuals' rights to their health information. Why HIPAA? Safeguards patient privacy and confidentiality. Legal penalties and fines for non-compliance are avoided. Improves your organization's trust and reputation. Covered entities. Covered entities are businesses or individuals who are directly subject to HIPAA laws. Covered entities often engage third-party service providers to assist in various aspects of their operations, and these service providers are referred to as business associates. Healthcare providers including doctors, hospitals, clinics, dentists, psychiatrists, pharmacists, insurance companies, Medicare, Medicaid, individual health insurance policies, healthcare clearinghouses are few examples. Business associates. Individuals or businesses that perform duties or services involving PHI on behalf of covered entities, e.g., healthcare providers, health plans, are referred to as business associates. Billing companies, IT service providers, consultants, transcribing services, pharmaceutical companies, legal services representing healthcare providers are a few examples. HIPAA Privacy Rule primarily focuses on protecting the privacy and confidentiality of individuals' protected health information, PHI, enforced by the Office for Civil Rights, OCR, within the Department of Health and Human Services, HHS. Violations can result in civil monetary penalties and corrective action plans. HIPAA Security Rule focuses on safeguarding the confidentiality, integrity, and availability of electronic protected health information, ePHI, enforced by the OCR, with violations resulting in civil monetary penalties, corrective action plans, and audits. Case Study. Chesapeake LLC, located in Tennessee, provides legal, compliance, accounting, operations, and health information management services. Those services require access to ePHI, so CHSPSC is classified as a business associate and must comply with HIPAA security rules. On April 10, 2014, CHSPSC was attacked by an advanced persistent threat group known as APT-18. Through CHSPSC's Virtual Private Network, VPN, hackers were able to access its information systems remotely. A total of 6,121,158 ePHI records were exfiltrated from CHSPSC systems by the hackers, which includes name, sex, date of birth, phone number, social security number, email, ethnicity, and emergency contact information. It costs the company a financial penalty of $2.3 billion. Compliance structure of business associates. HIPAA Compliance Officer manages organizations' HIPAA compliance initiatives, develop comprehensive policies and procedures that address HIPAA requirements, ensuring BAAs are signed with all applicable covered entities and subcontractors. Develop a process for reporting potential HIPAA violations internally, implement administrative, technical, physical safeguards to protect PHI, incident response plan to address security incidents, breaches, and violations. Regular updates about changes in HIPAA regulations and related healthcare laws. Conduct regular internal audits and address any potential violations. Business Associate Agreements, BAA, and HIPAA compliance. Under the Health Insurance Portability and Accountability Act, HIPAA, in the United States, a covered entity and a business associate are required to enter into a legally binding agreement known as a Business Associate Agreement, BAA. A BAA is used to make sure that HIPAA regulations are followed when handling protected health information, PHI. Business associates are required to comply with the HIPAA security rule and the HIPAA privacy rule, just like covered entities. This calls for the implementation of security measures, continued data security, and adherence to privacy standards. HIPAA training awareness. Access control password security. Only access PHI if you have a legitimate need to know for your work duties. Never give out your access credentials or passwords to anyone. Create strong, one-of-a-kind passwords for PHI-enabled systems and applications. Passwords should be changed on a regular basis, and easy-to-guess passwords should be avoided. Physical safeguards. Secure physical access to areas and devices where PHI is stored. Use locks, access cards, and security systems to restrict entry. Store physical records containing PHI in locked cabinets or rooms with restricted access. Secure transmission. When communicating PHI, use secure methods such as secure email, VPNs, or encrypted fax services. Sending PHI over unprotected channels such as normal email or text messaging should be avoided. Mobile protection. Ensure that work-related mobile devices, e.g., cell phones, tablets, have security features such as PIN locks or biometrics. Enable remote wipe capabilities in the event that a device is misplaced or stolen. Remote work. When working remotely, use security precautions such as secure VPN connections and strong authentication. When accessing PHI via public Wi-Fi networks, exercise caution. Continuous risk assessment and monitoring. Participate in security risk assessments and audits to identify and address vulnerabilities and risks associated with PHI, ensure compliance with healthcare privacy regulations, and maintain patients' and organizations' trust. HIPAA compliance is a shared responsibility, and your participation in this training is crucial in upholding these standards. Thank you for your continued partnership and dedication to maintaining the highest standards of HIPAA compliance.